I'm Dr. Suresh Ramalingam, Professor of Hematology and Medical Oncology and Deputy Director of the Winship Cancer Institute of Emory University in Atlanta. I'm a thoracic oncologist, and I focus on the treatment of lung cancer and research on lung cancer. So what is the prognosis for lung cancer based on various stages? Well, first of all, let's take a step back and talk about how cancer spreads. Typically, cancer starts in one part of the body, and as this course of events advances, the cancer grows and starts spreading to other parts of the body. And when it spreads, typically, it spreads from where it started to the neighborhood lymph nodes. And from there, it goes to other parts of the body like the brain, the liver, the bones, the adrenal glands, and lungs. So when somebody is diagnosed with cancer, the first question we ask is, what is the stage of the cancer? And the stage is merely a representation of how far has the cancer spread. We broadly think about cancer as localized, which means it's still confined to the place where it started. The second category is locally advanced, which is the cancer has started to spread in the neighborhood. However, it has not spread to distant parts of the body. And the last group is what we call as the metastatic disease, where the cancer has spread to other organs in the body. It's important to know which particular group a particular patient's situation fits into, because the treatment options are tailored to the stage. For instance, if patients have stage 1 or 2 lung cancer, or even some subsets of stage 3 lung cancer, surgery and potentially chemotherapy, and in some instances radiotherapy, are used as treatment options. With this, our intent is to cure the cancer. And the good news is for stage 1, 2, and even some 3A cancers, cure is possible in a substantial subset of patients. When we talk about locally advanced cancer, we often use chemotherapy and radiation in a combination approach. And even there, we're able to cure approximately 20 to 30% of the patients. Now in stage 4 disease or metastatic disease, cure is very unlikely, though I would say that notion is being challenged by some exciting advances in immunotherapies and combination approaches. What I would say is in metastatic disease now, long-term survival is possible with targeted therapies and immunotherapy. For instance, if you take a look at ALK-positive lung cancer, the average survival is now beyond 5 years. If you look at EGFR mutated stage 4 lung cancer, the average survival is now 3 to 3.5 years. If you look at a certain group of patients with high biomarker expression levels for immunotherapy, the 5-year survival rate is over 30%. So we're beginning to see longer and longer survival, not cures, not yet where we want to be, but substantial progress compared to where we came from. So the best outcomes are seen when lung cancer is detected early. And this is why screening is important. We now have proven methods to detect lung cancer early in the form of CT scans for patients who have a history of smoking. So we need to get the message out to screen people for lung cancer as part of their annual physical exam if they are candidates for it. That will result in almost 80% of lung cancers being detected in stage 1 or 2, where the cure rates are over 60 to 70%. We don't want to find out after it's too late. We want to find out early. So we need to do a better job of getting the message about early detection of lung cancer. And the final point I would make is, regardless of the extent of the cancer, with appropriate staging and treatment methods, long-term outcomes are now more realistic for patients and physicians to expect.